This is the Man Up Podcast, a doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask. We have the answers. This week, our episode is titled Clapping Back on Sexually Transmitted Diseases and Genital Hygiene. I'm Dr. Kevin Chu, and I'm joined as with my co-host, beautiful Dr. Justin Dubin. What's up, Justin?
How are you, Kev? I'm a little sunburned from being in Colorado on the snow. My nose is really red, so
You didn't put any
dermatologist.
sunblock on there or anything
I
like
did.
that?
I put the SPF 30. I guess I forgot the first day. Okay, I forgot the
Maybe it
first
was
day.
just some like maybe it was like a somewhat windburn or something like that. I don't know.
Yeah, I don't know. It was bad, but it was a good
The
trip.
photos look great
Um,
though, right?
yeah,
Vail looked amazing.
Vail is amazing. That was my first time in Colorado. I really loved it. Definitely want to go back.
Yeah.
Absolutely. Just all time snowboarding experience. But back to today. I'm really excited. We have a special guest, a friend of mine from college who's been very successful in life. And I'm glad we get him on. But we're going to be talking about STIs, STDs. This is something that guys don't like to talk about, girls don't like to talk about. Really, no one likes to talk about, right, Kev? I mean, it's pretty hush hush stuff.
It's a little bit of a sensitive kind of topic, but it's really important. Like these are things that should be addressed, can be prevented, and so this is knowledge that everyone should really know about.
Yeah, and the thing is, even though people don't really talk about it, they're there, they're
Oh,
present,
they're
they're
there.
actually pretty common. And as we're going to learn today, probably more, it's going to scare a lot of people. I'm not going to lie. But, according to the CDC in 2018, 1/5 of people in the United States had an STI. That's 68 million
Wow,
infections annually.
wow,
26 million US new STIs or sexually transmitted infections, sexually transmitted diseases, STDs. We're going to kind of flip back and forth
yeah.
with that terminology in 2018. And almost half of these STIs were amongst the ages of 15 to 24 years old. So it's common out there. And I just want to, we'll welcome on Dr. Karl Saardi. Go ahead and introduce yourself and we'll get going.
Sorry, the audio cut out there a little bit. I didn't hear anything about sunburn. So, yeah. Yeah, my name is Karl Saardi. I'm one of the dermatologists here at GW. Um, I did my residency training at the Georgetown University and have been here seeing patients in clinic and in the hospital since then for the past 2 years.
All right. Well, Dr. Sardi, thank you for joining us. Why don't we get started? All right. So, STDs or STIs, everyone's scared of them. So, what is the most common STD?
Yeah, I would say, with regards to sexually transmitted infections and diseases, there's really no cause for alarm. The majority of them are very treatable, and we'll touch on that a little bit later. But probably the two most common ones, and two of the ones that actually cause the most concern amongst patients are the human papillomavirus or HPV virus and the herpes viruses. Um, for some reason, people are very scared of these two things, even though they're circulate widely in the community. Lots of people have been infected with them without even knowing it, and in general, they don't really cause too many problems, um, and can be treated either with your own immune system or with medications. With the human papillomavirus, it's super common. We've probably all had some form of it. There's like over 100 different strains of the HPV virus. It's kind of like COVID. It's the original one with lots of variants, um, and yeah, in most people it causes warts, warts of the feet, warts of the hands, genital warts sometimes. You could pick it up in a public shower back when we used to do that, or uh,
I didn't know that. Wait, you can actually get HPV in
How
the
how do you
shower?
contract it in the shower? I'm very curious.
No one's taking showers now. You just ruined showers for everyone.
well, luckily COVID got there first, but yeah, it's just even very mild skin to skin contact or contact with something that has the HPV virus on it can transmit it. The good news is that the types of HPV that most people get that cause warts of the skin generally don't cause cancer, and that's the feared kind of downstream effect of HPV infection. Um, it definitely certain strains of it are definitely associated with cervical cancer in women, And now we're finding more and more that it's associated with penile cancer and other forms of cancer in men. But generally, if it's showing up as genital warts, really nothing to worry about. Usually, they're just going to stay as genital warts. Your immune system's going to get rid of it, and you'll move on with your life. Um, and then the herpes viruses also are really, really common. Um, Probably over 90% of people have had one or both forms of HSV, and it can be transmitted by something as simple as a kiss from a parent or relative when you're younger. We see a lot of kids who have come into the emergency room with a new herpes infection of the mouth, and when you ask the parents, they'll say, "Oh yeah, like they were, this relevant was over at our house, and they had a cold sore and they kissed them," and that's actually super common.
I saw that on the internet actually. Someone was like, it was one of these photos that were being passed around, and it was like this baby that had like all these sores in the mouth. And they're like, parents don't kiss your newborns, but I guess it can happen, right? It's
Right, you kiss the feet. You kiss the feet. Kiss the feet. Right, right.
Yeah.
And
It's just out there.
So, what percentage of people would you say have HPV, and what percentage of people have? You said 90% of HSV, but when we're talking about herpes simplex virus genitals, what percentage of people have genital herpes?
I think it's as high as 50%, in some groups of
Wow.
people. Yeah.
50%.
And the good news is most
Now,
people have no symptoms. So it's something that you can be infected with and really never have any problems from it for the rest of your life.
having said that, I don't think anyone would desire getting it, right? I mean, it's obviously it's not the end of the world, as you said. Now, what percentage of people would you say have some form of HPV? Because I think it's important. Herpes. I think people get these two things confused a lot. Now,
Definitely.
herpes
Yeah.
obviously is very different. We don't really have a cure for herpes. We don't have a cure for HPV, but we do have a vaccine for HPV. Doesn't cover all of them, like you said. There's a million variants, but does cover the ones that um, that can cause cancer potentially is the thought process, and really kind of get rid of all like cervical cancer and guys you mentioned, also throat cancer in guys. So that you see a lot in ENT, um, but which is kind of like a humble brag, whatever. But anyway, so tell me about the HPV vaccine and how that differs from other things that is going on. Like what age groups are guys like guys our age? Can I still get the HPV vaccine?
So I'll say it depends on your insurance. um,
Really?
it's actually, I think, approved for all ages, and right now I think most pediatricians are vaccinating both boys and girls prior to what we call sexual debut or like first sexual encounter, um, because that's really when you're going to have the most impact in terms of preventing an infection with potentially cancer causing strains of HPV. It's also recommended. I have to check my notes here, but up to age 26 for everybody. So most insurances should cover it up to age 26. And then it's also recommended for adults above age 26 if they're continuing to have new sexual partners. Um,
So there's really no reason. There's really no reason to not get the vaccine. It seems at any age.
we see tons and tons of patients with just warts, and I always tell them, especially if they're a young person, that you should probably we don't have and unfortunately we don't have the HPV vaccine in my clinic, but I always tell patients with warts, like, talk to your doctor about getting the HPV vaccine. And the reason is, even though the strains of the virus are different in terms of the vaccine versus the ones that cause warts, we've seen warts just melt away after people get the HPV.
Really? Wow.
Yeah,
Wow.
yeah.
That's amazing. That's like
That's crazy.
it's like vaccine or cure, right? Like,
Yeah, absolutely. I mean, if it's something that they're already, eligible for, it may not be something that's at the top of their doctor's list of things to do in a visit, but worth asking about, definitely. And
I think it's a great point because I don't think many guys are thinking about that. We talk about the HPV vaccine a lot for women because of cervical cancer, but
mhm.
this is a great point, right? It's never too late to get the vaccine. And you said you've seen it can really help make a difference, even if you have it already. So there's really no reason to not
I
get
mean,
it.
Justin, I think that's the point. Like, even if you have it, you should still get it, and it could, help out. So I think that's fascinating.
It's crazy. I didn't know that. I learned that today for sure.
yeah, but I guess going back to your question about how common these are, I would probably say close to 100% of people have probably had HPV of some sort.
Damn, wow.
But it's hard to say because not everyone shows symptoms of like warts or whatever. And we also don't have antibody tests for it. We have antibody tests for HSV, and we can kind of look at how many, for herpes at least, and we can see how many people have been exposed to the virus at least.
Yeah.
Um, and that was kind of like the other point. You should really never get an antibody test for the herpes virus. It's going to be positive. It's going to cause a lot of anxiety. Just avoid it if you can.
Is there a reason to get it? Is there a reason to get it ever or no? Herpetic encephalitis. I'm guessing maybe like I don't know.
I honestly can't think of one. And actually, the funny thing is, I don't know if you guys saw the documentary on Theranos. That's I think like on Netflix or
Yeah,
something.
yeah.
That was the only test that they had approved.
Really?
A completely useless test.
It was always going to come back positive. They knew what the answer was before they had even to do the test. You know?
That's brilliant. It's actually
that's
brilliant.
It's brilliant.
Let's talk about another thing. You know, we talked about how those two are contracted, but a lot of a common question that we get, I get, I think Kevin gets as a urologist is we see a lot of, you know, guys and sometimes their partners or when they're having sex with them, female partners can often get UTIs. And a lot of men and sometimes their partners have asked, you know, am I getting a UTI? Is this a sexually transmitted disease? Like, can I be transferring my UTI from two ways, right? The question is, if I have a UTI, can I get my partner infected by it, like an STD? And is my male partner giving me UTIs through their semen or something? Can I get a UTI from semen? So it's kind of a two-part question. If you can kind of like explain that to us.
Yeah, generally, you know, UTI, urinary tract infections are not sexually transmitted. Um, that being said, it seems like a lot of at least a lot of women, at least, who are make up the bulk of UTI cases, do report that sometimes after sexual activity they can develop UTIs. And actually, interestingly, it seems that seems to be related to spermicide use as a form of contraception. Um,
Mm.
I'm not exactly sure, why that is. Um, some people find that women especially find that urinating immediately after sex can actually reduce the chances of having UTI.
I don't think that's true, actually. I don't think the
Oh,
data
really?
supports
Okay.
that. Yeah, I don't think the data supports that, actually. What do you
And
think,
I
Kev?
also think the spermicide also like kind of messes around with like the flora around it, right? The
Correct.
bacteria,
That's
the
my
natural
understanding.
bacteria, and so that's actually why it may cause a imbalance of what's usually there, and that causes the development of the infection.
Yeah, and I think when we're talking about can a guy just by having sex with their partner in their sperm give like can you have like dirty sperm that gives a UTI? The answer is really no. I mean, you know, as we like for the most part, I won't say semen is sterile because as we
I've
become
seen
more and more
some
knowledgeable,
positive semen cultures, right?
correct.
Yeah,
Right. You can have infections through your prostate and stuff like that, but still, it's not likely you're going to transfer that
right.
infection to your partner. Really, you know, the bottom line is like a UTI is kind of from in the female perspective is often because of the factors like you guys said. The truth is, you know, the urethra is a lot shorter, which is the the tube that you pee out of, your bladder connecting to
Hmm.
the outside world. It's a lot shorter in the female, and so there's a lot more opportunity for bacteria to get in and have a more readily infection. And then often when you're engaging in intercourse, you know, things happen and it's a potential nidus to get that infection. But can the sexual, you know, the sperm itself? Probably not, is not going to be the thing that's giving you a UTI.
Yeah. I will say that there are these kind of two unusual bacteria, and it's kind of funny. They barely qualify as like what makes up a bacteria. They're almost like viruses in some ways. Mycoplasma and ureaplasma. I'm sure you guys have come
Right.
across this.
Yeah,
I
Mhm.
guess those are considered like sexually transmitted, and they cause UTI like symptoms, but they're not really urinary tract infections. I would say that's really the only way you'd have like a some sort of an infection of the urethra that's transmitted, other than the usual suspects.
Right.
yeah, but generally for the most part, like through like semen and stuff like that, like Justin was saying, you're not really transmitting any of that. But back to so let's go back to STDs. So how effective are condoms or other things like dental dams? Are they effective in preventing transmission?
Yeah, so most of these STDs, things like syphilis and herpes, especially, they're much more infectious when there's actually an open sore, like when the disease is active. So things like condoms can be very effective. Actually, while I was reading up, preparing for the podcast, I actually found out that there's new terminology around condoms. I don't know if you guys have heard this. Um, they're for condoms that are placed on a penis or a neophallus. They call them external condoms, and then for what we used to call female condoms, people are calling them internal condoms now. To,
Interesting.
yeah,
Never heard that.
yeah, it was. I just learned that today. I guess it's to be more trans inclusive. With these forms of barrier contraceptives. Um,
Wow.
Rather than calling them like male condoms or female condoms, they're
Yeah.
calling them internal and
Yeah.
external
Yeah.
condoms now, which I thought was cool, and it makes a lot of sense.
Yeah.
Yeah.
Um,
But what do you have a number? Is there a number for efficacy for these kinds of, like I think condoms obviously as a contraceptive, condoms are for two things, or any kind of barrier contraceptive is really for preventing, can do two things, right? Prevent birth,
Mhm.
fertility, and it can prevent the spread of, disease. Now, do we have a number on the efficacy? Is there any? Do we have an idea, or is it just kind of like one of those things that it definitely reduces?
yeah, so most of the stuff we know about barrier contraception like condoms is from when the HIV epidemic was really taking off, and we know that it definitely reduces the risk of HIV transmission amongst couples where one partner has HIV and the other doesn't. So that's really where the best data comes from, is for HIV infection. Um, and it ranges based on the study. I think it's 30 up to 60%, was the number I was seeing, or the numbers I was seeing.
Prevention rate or infection rate?
Oh, prevention. Yeah,
Okay. So 60% of the time it works.
yeah, over a period of years.
Yeah, right.
In terms of single sexual encounters, I actually that was like one of the things that I found most surprising in medical school, is like the chances of getting HIV from like a single sexual encounter from someone that was infected was like 1 in 100 to 1 in 1,000, which was actually kind of surprising to me. It seemed like it would be way higher, and
Right. Right.
um, at least we're talking about male female insertive like vaginal intercourse.
Hmm.
Um, I don't know why it seemed like it would be way higher, but the risk is already like relatively low, but condoms can definitely bring it down quite a bit. We don't know a whole lot about other sexually transmitted diseases. Um, it's probably very effective for things like bacteria, like chlamydia and gonorrhea, syphilis, probably like basically larger bugs. Um,
Right.
but
Makes
versus things
sense.
like viruses, it's harder to say. And we have even less data about like internal condoms and dental dams, to be honest.
Yeah, and that makes sense. I mean, a lot of it too, especially like these viral ones, is it can be through, not it's not just skin to skin, but sometimes vaginal secretions and things like that. Um, and obviously, a condom can protect against that, but it's not going to always be able to protect against all of that. It's really designed to prevent sperm from getting through and stuff like that. But I so it is something to think about. But obviously, if you are concerned, always use condom. New partners, it's always smart to use a protection.
Yeah, and I'll just make a plug for using condoms correctly. I feel like most people, I'm sure you guys have encountered this, like most people don't really read the instructions on like how to use condoms, and I think that's a big part of it. Like using them correctly for sure is really important.
What's a good way to practice this?
I've never really practiced. I kind of just read the instructions, but
But you're right. You're right. People don't know how to use condoms. They don't.
yeah, totally. I would say there's probably not a lot of good YouTube videos on this.
Oh, I'm sure there are, dude. There's got to be. It's like the banana or the something.
Yeah, a lot of guys actually came up to me and said like they learned it from watching porn of like quote unquote how to put on a
Interesting.
condom. Yeah. I don't
I
know if
had
they're
no
doing it
idea.
correctly though. Who knows if they're doing it correctly?
Who knows if the porn stars are doing it correctly?
I was going to say the opposite. I was going to say you're learning from the experts.
That's
Oh man,
true.
you're
That's
right.
true.
You're
That's true.
right. It's a good point. It's a good point. Um, so we talked about a lot of these diseases. We talked about, it seems like HPV and herpes are the most contracted ones, the most easily contracted. Um, I think it's important we kind of talk about which ones are curable and which ones kind of stick with you, right? So, can you kind of just give us a quick breakdown of which STDs slash STIs are ones that we know we can cure with medicine, and the ones that are kind of more permanent?
Yeah, so I'll say syphilis for sure is like the most curable like STD
Mhm.
ever. We've been using like penicillin for it for like 100 years. Like
Yep.
there's
Yep.
no syphilis that's like where penicillin doesn't work. And actually a lot of times in dermatology clinic, if a patient comes in with an unusual rash, and the thought of syphilis even crosses my mind, I'm very upfront with them. I'll tell them, I'm not exactly sure what's going on, but syphilis can sometimes look like this. Like, would you be okay with getting a test for this? And it actually, when it comes back positive, which it does actually fairly often, um, it it's a huge relief to me because you can just give them like one or potentially three doses of penicillin and cure their rash versus other things like psoriasis or eczema, other things that can cause rashes that look very similar. Those require, lots of creams, chronic treatments, medications that alter the immune system. They're actually much more difficult to treat. But syphilis, for some reason, really gets a bad rap as being like a very taboo STD somehow. But it's just like super treatable. You can prevent like seriously life threatening complications.
That's
Right.
so weird. You're describing it as like a syphilis getting a bad rap, man. I don't think. But like, just to bring it up now that you mentioned, what are the more common symptoms and signs of having syphilis?
So usually 80% of people will develop a sore that's painless, somewhere on the genitals, sometimes in the mouth. It kind of sticks around, usually a couple of weeks after sexual intercourse with someone that's infected, and then it'll go away on its own. Most people, will think nothing. It's actually extremely rare for to see like, a primary like ulcer from syphilis, like a sore from syphilis. Most patients will come in when they develop the rash, which we call secondary syphilis, um, which is kind of like a rash all over the body, scaly, sometimes a little itchy. And again, the tricky thing is that it hangs around for a few weeks and then it goes away on its own.
Mm.
So most people
Mm.
don't even know that they've been infected. They're like, "Oh yeah, I had this rash and it went away," um, or "I had this little sore and it kind of got better on its own. Wasn't really bothering me, so I didn't do anything about it." Um, so those are the two main ways that syphilis shows up. But untreated, it can cause serious problems with the heart and the major arteries in the chest, problems with the brain, joints,
Right.
nerves, and it's
And
just
so,
so treatable.
is there a time, is there a time frame that you got to get treated before you really start developing these like more
It's a good question.
serious, like effects of syphilis?
Usually within like if you get treated within 1 to 2 years, you can avoid pretty much all of those, late consequences of having.
Years, so you got some time. You got some
Yeah,
time.
you
Some
got
time.
plenty of time. um,
Get it treated though. Don't
Yeah,
just be
yeah.
hanging out with
Don't wait. Don't
syphilis.
see if it.
I'm actually really grateful. I work in DC because there's actually a recommendation that pretty much everyone in the district who's sexually active get a syphilis test, every so often. Um, so primary care doctors and other doctors out there in the community are really good about this, and it's just really really common in district and really any metro area. Um, and I think just people don't broach the question very often, like, "Hey, do you want to be tested for syphilis?" Because I think doctors are a little embarrassed. Patients are definitely embarrassed. But it's like one of the most treatable and most easy to treat and treatable STDs out there.
Hey, so for our listeners
Awesome.
out there, if you think you got syphilis, don't be afraid to like bring it up to your doctor because a few shots and you're going to be good to go. So
It's a great point, Kevin. I think that we were in the middle of something, but I do want to kind of piggyback off that. You know, how many people are scared to come in and talk about these things with you, uh, Doctor Sardi? Are a lot of people coming in months too late because they're like, oh, I didn't want to tell anyone that I had an
yeah.
STD, or how often do you see that? Is there a delay to care for people with STDs?
Yeah, it's just way too common. I think talking about issues surrounding the genital skin and sexually transmitted diseases are it's very hard for patients to come forward with those symptoms. And I would say, patients presenting very late is sadly kind of the norm, rather than people presenting too early. Um, and I would say, as soon as you notice something that's just not quite right, or something that's changing, definitely come in. Um, Even if we tell you, hey, this is something that's totally normal, it's considered within the realm of normal, nothing to worry about. Um, it's always better to come in earlier rather than waiting for something really bad or for symptoms to start. So, yeah, I would say the former is very common.
I mean, I mean, off that note, I think Justin, this is why we do this show, right? Like, these are things that guys, it's going to happen. It can happen, right? But it's okay. These things are treatable. Let's not get a stigma attached with them. These things are treatable. The faster you get them treated, the better it is, and we move on. You know.
Yeah, and we're talking about things, even the things that were permanent, like you said herpes and you said HPV that we talked about were more permanent. They're still very, very manageable, like you said.
Right.
Even with herpes, you take a medicine, and you said, most people don't even know that they have it, and that's kind of it. Um, that kind of leads to the other ones that I know are treatable, like gonorrhea and chlamydia. They kind of often go hand in hand. Now, what are those symptoms, and how I can? And I know those are curable as well.
Yeah, gonorrhea and chlamydia are also extremely common. Thankfully, less infectious than the viruses. They're both caused by a bacteria, and a lot of patients have very few symptoms, and that's kind of how these sexually transmitted infections. That's how they stay under the radar, by people really having very minimal symptoms. Continuing to have sexual intercourse, and the disease spreading. Um, for women, it can show up in the gonorrhea and chlamydia. They're almost indistinguishable, based on symptoms, or when you go to see your doctor. But women can have a vaginal itch, a lower abdominal pain, pain with urination, or what's called pelvic inflammatory disease, where the uterus and the fallopian tubes can be inflamed because of the bacteria that's there. And men can have even fewer symptoms. Sometimes a little bit of pain with urination, pain in the scrotum, due to inflammation of what's called the epididymis, the connection between the urethra and the testicles, as well as a urethral discharge. That's why they call. Oh man, I had a mentor in residency that would be so upset if I forgot this, but I forgot which one they call the drip. Do you guys know? They call
Oh,
gonorrhea or chlamydia the
oh.
drip, like the
One's the
colloquialism for
clap.
it.
One's the clap. I think chlamydia
Chlamydia
is
is
the
the
clap.
clap.
So,
I
so
think
I think
gonorrhea is the
gonorrhea is
drip.
that.
Yeah, yeah,
Gonorrhea
yeah,
is, dude.
yeah.
Why do they give such bad STDs such cool names?
Yeah, I know. Oh, you got the clap.
I mean, coming through with that drip. I mean, like, come on, the drip is like.
So,
so,
so we could
so
do a podcast about it hundreds of years later. Oh, sorry, listen to that.
I think one thing that I was just thinking about that I think that people would like to know when they're engaging in sexual activity. A question we often get a lot is like oral sex versus you know penetrative sex, anal sex. Like, is there a difference in contractibility? Like, if you give oral sex to someone if a guy gives oral sex to a girl who has gonorrhea, can I get gonorrhea in my throat? Can I get chlamydia in my throat?
Actually, yeah, it depends on the STD and the mode of sexual activity. Um, it's the gonorrhea for sure can affect the oropharynx, the mouth basically, and it can also affect actually the rectum. Um, that's why people who do engage in oral and anal sex, sometimes it's recommended that they have testing for gonorrhea and chlamydia, um, both not just from the urethra or the cervix, but also from the mouth and the rectum. Um, before saying that they don't have this STD. So, um, yeah, it can definitely happen.
And the viruses too, like all the viruses too, right?
Yeah, we used to think herpes was like sorted like perfectly, where the herpes simplex 1 virus was pretty much just of the mouth, and the herpes
Yeah.
simplex 2 virus was just of the genitals. And we're finding that they're kind of approaching convergence, where they're basically randomly distributed now, where people can have HSV 2 of the mouth or HSV 1 of the genitals, and it's becoming totally arbitrary. So that's really not the case anymore, with the herpes viruses, at least.
If can a girl give oral sex to a man and give them an STD? I'm just going through literally every scenario because I get these questions all the time.
Yeah.
We should come up with like a spreadsheet, like a almost like one of those Super Bowl.
It's like,
Just one of those ones you just go here
yeah,
and
yeah.
This is transmittable by this way. This is
Right. No,
actually, I wonder if that's out there.
A little pocket guide, that you bring around.
Yeah. All right, we're safe to that.
Yeah, I would say yes, especially with the herpes viruses. Again, kind of this crossover phenomenon between the herpes 1 and herpes 2 viruses. For other STDs, it's probably less likely. Like gonorrhea and chlamydia, I think are probably much less likely. But I think it varies, and we probably don't have great numbers on how common that is.
But if you're worried, there's dental dams, there's all that kind of stuff. Still, condoms are still usable in oral sex.
Yep, absolutely.
Just backtracking a little bit, just for our listeners. So, gonorrhea, chlamydia, how do you treat that? Just for their knowledge.
Yeah, good point.
Again, super treatable. I mean, it's just an injection of an antibiotic, and usually once one is diagnosed, a lot of doctors will treat for the other. Like if you're diagnosed with gonorrhea, unless they're 100% certain you don't also have chlamydia, they'll also treat you for that.
Right.
And there's a couple of reasons for that. One is that antibiotics are becoming less effective against gonorrhea. So sometimes, doing the combination of antibiotics is actually more effective. So just an antibiotic injection called ceftriaxone, and then a pill called azithromycin, or commonly referred to as a Z-Pak. But instead of taking the Z-Pak like you would take for pneumonia, it's just the one pill, or sometimes it's 4 pills at once.
Now, this, on that note of, talking about how antibiotics are not working as well, or we're worried about resistance, is there such thing as a super gonorrhea? I've seen it. People have sent me information about it. Is this true?
It seems very scary.
Yeah, there are pretty alarmingly high rates of resistance to ceftriaxone, at least for gonorrhea, and it's kind of resulted in having to use more and more toxic antibiotics to treat it, which is kind of becoming a challenge. There's an antibiotic in Europe that's really effective, but we just don't have it yet in the United States. And with a lot of these infectious diseases, there's really just not a lot of reason to study them in the U.S. because companies aren't going to make a whole lot of money selling antibiotics, it seems. So it is definitely getting harder to treat gonorrhea, and we're seeing higher rates of antibiotic resistance. Where ceftriaxone is kind of like a penicillin type antibiotic, extremely safe. It's been used for hundreds of years, or probably close to 100 years. We're having to use more toxic medications that can cause problems with hearing, kidneys, etc. Yeah.
But hey, we got to treat the super gonorrhea. We got to kill the super gonorrhea, man. We're not trying to mess with super gonorrhea over here.
Yeah, I mean, I think just safe sex practices and getting everyone tested and treated would go a long way towards preventing the proliferation of these bad bacteria.
Yeah, I mean, so we talked about treating those, and going back to the HPV and the herpes, right? We talked about how prevalent they are. We talked about the vaccine for HPV, but how about treatments of these genital warts? When you have genital warts, what do? What are the options?
Yeah, genital warts are extremely, extremely common, and really the whole name of the game is getting the immune system to wake up and realize that there's a little virus there living in the skin. And we can do that in a number of ways. If it's just a single wart, a lot of the times, I'm happy to just kind of remove it for the patient. That in and of itself, just the act of removing the wart surgically, is enough to cause inflammation in the area. That'll kind of recruit the immune system and let it know that, hey, there's a little virus here, get rid of it. Mm-hmm. But sometimes if there's more than one, we'll do things like what's called cryotherapy or cryosurgery, where we'll basically freeze the warts to kind of stimulate an immune response. It basically causes almost like frostbite in the area, and as a result of that kind of damage to the skin, the immune system kind of rushes in, and hopefully it picks up on the fact that there's a virus there. And there are a couple of creams that can do that can have the same effect. There's about 3 or 4 of them that are out there.
I will tell you that Kevin and I, as surgeons, We do this a lot, right, Kev?
Yeah.
Like, what do we commonly do?
We do, we excise them. Done like there's like laser therapy that you can do, or fulguration to some sort of extent. We also do the creams and all that stuff too, right, Justin? Am I missing one?
Yeah, I think if you have genital warts as a guy, your urologist treats it, your dermatologist treats it. There's a lot of people out there who can really take care of it. I used the laser literally last week on some genital warts. I know we've both did excisions on bigger ones, but there's a lot of different options. And when you remove them, they go away. But there is obviously no guarantee that these genital warts won't come back, maybe in a different area, but we can treat them and remove them as needed, which is important. Now, when we're talking about herpes, herpes, actually, you have these. Go ahead.
I don't know if you guys have heard of this, but for like plantar warts, for warts on the feet, did you know that duct tape is just as effective as a lot of the creams?
I feel like I saw that somewhere before.
Duct tape, huh?
Yeah, absolutely. It's not even kidding. A randomized control trial of duct tape for warts, and it's just as effective as a lot of the treatments that are out there. And it turns out
so there's people out there walking around with just duct tape on their feet because you told them to put on duct
absolutely.
tape.
I recommend it all the time, especially for kids.
Wait, so you just slap it on and then you just pull it off?
Yeah. It turns out a lot of people are allergic to the adhesive in duct tape, and that kind of jumpstarts the immune system as well, just about as well as anything else we have. So,
they put the duct tape on the penis or anything like that? I mean,
that I have not tried.
I think we got a research idea.
Yeah, let's collaborate, man. A randomized trial of duct tape on the penis.
I would not be surprised at all if it works, based on how we treat them in other ways.
I mean, it's kind of funny. It's so cheap too. It's such a cheap option.
This isn't vetted. There's no evidence behind that on the penis.
Yeah, please don't put duct tape on your penis thinking it's going to cure your genital warts. Please don't do that. But back to the herpes thing, right? So, how do we treat herpes? Because it is a permanent thing as well. How do we deal with patients if you find out you have herpes? What's the next step?
So, usually patients with herpes will either have cold sores that come and go throughout the year, or kind of a similar phenomenon on the genitals where they'll have a few very small blisters, on the genital skin. It can be actually pretty painful and debilitating for some people. Lasts a few days and then goes away. It kind of depends, on the person. If the person's having, one flare up per year, they might be okay with, taking just a course of the antiviral medications. And there's a couple different ways to do it, but they might be okay with just taking that at the first signs or symptoms of an outbreak. But once people start having like 2, 3, 4 outbreaks a year, that's when I like to start talking about potentially being on a once a day medication called valacyclovir, or people commonly know it as Valtrex. Extraordinarily safe medication, and it can really reduce the number of breakouts every year. So.
Now, does that, if you're taking Valtrex every day, are you inherently preventing the outbreak and preventing your partner from getting it?
I would say,
or are there no guarantees?
Kind of, and yes. If you're preventing the outbreaks, that's the thought, that it reduces how transmissible the infection is. Because once you develop those blisters are packed with virus, whereas kind of the normal healthy skin that's in the area probably has very, very little virus there, if any.
Okay. And now just to, before we start wrapping this up, those people who have partners who have herpes and you're worried about getting herpes, what's the chances of transmission from one partner to another, in a year? I think we've talked about this. It's pretty low. It's
very low. Yeah. And I think that people really shouldn't worry, because odds are they already have some form of the herpes virus already.
Right.
That's reassuring. Yeah. That's great for everyone.
We all got it. Don't worry.
Yeah.
But yeah, being on medication for sure can, reduce the number of breakouts. Abstaining from sex during breakouts can go a long way. And again, barrier methods like condoms can reduce the risk. And it's not terribly high. And even if you are infected, the chances that you'll have symptoms that are even bothersome to worry about or affect your life are pretty low in themselves. So it's
pretty reassuring. Now, I guess let's just end on one final question. for people who are worried, about getting an STD or, or approaching a doctor, what is some advice you have? What's the best advice you can give someone who's kind of worried about getting an STD, and then those who think they may have an STD?
Yeah, again, I'll say, don't wait. I don't think any complaint is too small to talk to a doctor about. We'd rather, see things early on and reassure you that something is totally harmless and normal, rather than get to it late when, we're dealing with things like more advanced, cancers or sexually transmitted diseases that maybe have spread to other organs or are causing other problems, or potentially you've passed them on to additional people, where you kind of have to go back and get in touch with those people to get treated as well. So definitely come in early. No complaint is too small. It's going to sound kind of weird, but especially for skin stuff on the genitals, take pictures. Sometimes how something is evolving can be really helpful to
That's a great point.
your primary care doctor, urologist, dermatologist, how something is changing over a period of time. And especially if it's something that's coming and going, knowing what it looked like when it was there is hugely important. Now that everyone has, cameras on their cell phone, there's like no excuse, to not take a picture of something if it continues to happen. And I guess the other side to the same coin is demand an exam. Don't settle for someone, not examining the skin or the genitals in general. If you come in with a genital related complaint, it's so common. Like, you wouldn't believe it. Like, I have patients refer to me all the time, and they said, oh, this person, sent me here because I had this problem. But they didn't even, look at the skin there. They didn't even look at, my penis or my vagina or whatever. It's extremely common, and if there is something there to see or some symptoms there, definitely demand an exam from your doctor. But yeah, I think that would be it.
I think that's pretty great, and I think that I really appreciate you having coming on today, Dr. Saardi. I think the main thing is these things happen. A lot of people have them, and although it stinks to get an STD, I think the good news is if we can't cure it, we can manage it. And most of the time we can cure these things. So, if you see it or you feel something wrong, like you said, make sure you go to the doctor. The further you let this thing go, the worse it can get, especially if we can manage it. Nothing to be embarrassed about. And I think another important thing, just to, as I'm wrapping up here, is to mention is that we aren't talking to anyone else about your STD. We're not talking to your partner. We're not talking to your partners. We're not talking to your mom. We're not talking to your dad. We're not talking to your sister, your brother. This is really just between you and the doctor. This is a personal conversation. We're here to help you. I don't care what scenario you got it or how you got it. We're here to fix the problem. And I think that is really the most important thing, that a lot of people, I think, sometimes have this idea that we're going to judge them for coming in, for doing these kinds of things. And that's far from the case, right?
There's no judgments. There's no judgments made within the four walls where you're there with the physician. We're there just to get you better. And, like Dr. Saardi said, and like me and Justin, I'm sure Dr. Saardi too, have seen these things when they've gone on for way too long, and you're just like, you've been letting that thing just kind of fester for like years. And like the management for it is like so much like worse, and it has bad implications for you as a patient, So, like Dr. Saardi said, don't wait. And like Justin said, no judgments made. Come to and see the doctor as soon as possible. So
I agree. And with that excellent conclusion, I think we're going to wrap up. Once again, Dr. Saardi, thanks for coming on. We definitely learned a lot. There's so many other things we have to talk about. So we'll make another episode about, for sure. That's going to be some really fun stuff that we already have an idea of what we want to talk about. So thanks again for coming on. As always, to our listeners, thanks for listening. You can follow us on all platforms. Man Up Pod can be found on Twitter, Instagram, TikTok. Kevin, what's our website?
It's www.themanuppod.com.
So you can find all of your resources there for everything Man Up. You can also listen to our podcast on our website. You can listen to it on Spotify, iTunes. Always review, subscribe, give us a comment as well. 5 stars is always appreciated. For Kevin and Dr. Saardi, thanks for listening. Until next time, have a good one.